We're back with Commissioner Victor Calise, and now we're joined by Carol Glazer. She's the president of the National Organization on Disability. Edward R. Matthews is also here. He's the CEO of Adapt Community Network. Thanks to everyone for your time today.
Thank you, Cheryl.
I want to start with you, Ms. Glazer. Yes. I appreciate you being here especially. Yeah. And let's talk facts, okay? 20% of the American population has a disability.
That's right.
Yet they make up only 3.9% of the workforce. Now, with the commissioner, we were talking locally, but now with you, we're talking nationally. Yeah. Why is that number so low nationally?
Just to be clear, the number 3.9 comes from a tracker that my organization has. It's a survey, an online confidential self-assessment. And we now have 200 companies in that database. Which is a good solid number, every industry sector. And the average number of people with disclosed disabilities in those companies, which represents several million workers, is 3.9%. So already a cut of companies that are federal contractors and that are large part of the Fortune 1000. So if that's the number of disclosed disabilities in that workforce, it's quite likely the number is going to be even less in smaller companies and those who have less support for people with disabilities.
Well, Mr. Matthews, this is nothing new to you. You are a veteran in this field, more than 30 years experience. Why hasn't the needle moved much over the decades?
You know, I wish there was a quick answer to that. There are so many barriers to employment. Some of them are government related, some of them are, a lot of them are employer related, some of them are transportation related. It's very difficult without good public transportation in many places for people with disabilities, particularly those with motor impairments, to get to work. I mean, unless they have a motorized chair themselves, or unless there's good transportation, or unless they have access to their own car, it's very, very difficult for people to get to work. But the barriers to employment are mostly employer related. Whether it's accessibility issues, whether it's not knowledge about what people can do. People simply look different, so therefore they're presumed to be not able to work. So there's a million reasons why it's been such a problem. And you know what our focus is, quite frankly, is just one person at a time.
One person at a time.
You know, we deal with the people, the policy guys. You know, are trying to affect a broad spectrum of things, but. You know, for us, it's trying to get that person the next job and what they can do, and get somebody to hire them. And that, you know, it really is it's a slog, but it's something that we're very proud of, that we've been accomplishing one person at a time.
One person at a time. 1 in 4 New Yorkers.
1 in 4 New Yorkers is on Medicaid, and that's one of the barriers. You know, to be honest with you, I mean, people do not want to work full time and lose their health insurance unless they're able to work, get paid the wage, and get on the employer's health coverage.
And that's a great reason why I was worried, because when I was injured 24 years ago, I was on Medicaid. And I was worried about making that leap into the job force. Will I be able to have my benefits? And if I don't have my benefits, what happens? And if I do work and then I'm not working anymore, am I able to get back on those benefits? And that's real for people, because some people are medically fragile but can work, right? That's not an issue. Or people just need their health care, because everyone needs health care.
Right. And
in our field, there's a concept called the cash cliff, which is what happens to you if you get a job, you lose your benefits, you go over a cliff. And so it can be an irrational decision to actually accept a job. If you're getting, Medicaid is very good health insurance. So if you're getting such good insurance and cash,
you also talk about fears, myths, and stereotypes.
Yes.
What do you mean by that?
No, I think if you think about history and you think about disability in this country, in our society, for the longest time, people with mobility impairments were not able to leave their homes. There were no curb cuts. You couldn't go anywhere. And people with cognitive or mental health issues were institutionalized, where they could be cared for by specially treated, specially trained individuals. And we had those beliefs until a very short time ago, so most people didn't see people with disabilities in their communities, in the workforce, and we're afraid of what we don't know.
When you're not seen, you're not heard.
When you're not seen, you're not heard.
And it's so important to be in the workplace. That really changes perceptions.
Sure, sure. And let's talk about transit. Andy Byford, the new head of NYC Transit, doing a good job?
Well, I'll leave that to Victor. I think he'd know more about whether he's doing a good job than
Yeah.
I do. But I think, I think really until the city, the state, and the federal government are going to put more money into the subway stations and getting, the buses are fine.
With
They've been
accessibility?
With accessibility, then I think it's very, very difficult to move massive amounts of people.
Sure, and you think he's doing a good job
well,
for people with disabilities?
Well, he has a focus, and his fast-forward plan is to really increase accessibility. And the city has been engaging with a working group to talk about what accessibility can be done and what ways that we can work together to increase the accessibility. And I think that's really important, not just for people with disabilities, for the aging population and parents with strollers, because that's a lot of people who use that
There's a
elevator.
lot of people in that group, too. Okay, time for another break. In Focus continues right after this.